This is the VOA Special English Development Report. The healthcare industry needs more nurses. All areas of the world face a nursing shortage, but the shortage is most severe in developing countries. Many of their nurses leave. They move to more developed nations for better pay, better working conditions, and better chances for career development. A World Bank report earlier this year called attention to the problem. For example, nearly 2,000 nurses left the Caribbean between 2002 and 2006. Caribbean nations currently have about one nurse for every 1,000 people. The ratio of nurses to population is about 10 times higher in the United States and countries in the European Union. Currently, more than 21,000 nurses who trained in the Caribbean are working in the United States, Canada, and Britain. Gaëtan Lafortune is with the Organization for Economic Cooperation and Development in Paris. He says the nursing shortage also affects industrialized countries. Mr. Lafortune says a large number of nurses are expected to retire within the next 10 years. At the same time, the healthcare needs of aging populations are expected to grow, intensifying the shortage of nurses. He says some researchers in the United States have projected that there may be a shortage of close to 1 million nurses by 2020. The United States is one of 31 countries in the OECD. Gaëtan Lafortune says in recent years, many of the countries increased their efforts to hire foreign nurses. But he says this has raised concern that OECD countries were mainly exporting their shortage problem to countries that may have an even greater need for these nurses. In May, the World Health Assembly approved a global code of practice on the international recruitment of health workers. The Assembly is made up of countries in the World Health Organization. The code advises against actively recruiting health workers from developing countries that face severe shortages. The world also faces a shortage of nursing trainers. As a result, nursing schools are forced to turn away qualified students. And that's the VOA Special English Development Report. You can find transcripts, MP3s, and podcasts of our reports at voaspecialenglish.com.
This is the VOA Special English Development Report. Researchers say they have found a way to extend the storage life of a drug used to treat HIV. Their work could give infected mothers in the developing world a new way to prevent the spread of the AIDS virus to their newborn babies. The drug is nevirapine. If it is given within 72 hours after birth, it can often protect babies from HIV. Researchers at Duke University in North Carolina have developed a small pouch made of foil and plastic. They say current tests show that the pouch can safely store the drug for as long as 4 months. But they expect that final results in October will show it can keep the liquid stable for up to 12 months. That way, HIV-infected women could have plenty of time to get the pouch from a healthcare provider early in their pregnancy. Carolyn Gamache is a biomedical engineer at Duke who worked on the project. She said many mothers in sub-Saharan Africa deliver their babies at home. They could receive this pouch early in their pregnancy when they have their first doctor's visit. Then they would have the medicine at the time of delivery. The drug company Boehringer Ingelheim developed nevirapine. It says 1 dose of the medicine given to mother and child prevents the spread of HIV in more than 50% of cases. Boehringer Ingelheim has been working with the nonprofit organization PATH to offer a similar pouch for the past several years. The nevirapine is contained in a small dropper placed inside the pouch. They got the idea from health workers in Kenya. The workers had been putting the medicine into droppers, then wrapping the tube with tape, aluminum foil, and plastic. PATH designed a foil pouch to hold a medicine dropper containing nevirapine. The drug is considered safe for up to 2 months in the dropper. The pouch itself is only for packaging protection. Adrienne Berman is with the PATH office in Seattle, Washington. She says the pouch is an important tool for preventing the spread of HIV from mother to child. She noted a United Nations report that in 2008, about 430,000 babies were born with HIV. 9 out of 10 were born in Africa. The report said nearly all the mother-to-child infections could have been prevented through interventions. And that's the VOA Special English Development Report.
From VOA Learning English, this is the Technology Report. Smartphones are small and easy to carry, so they are always ready when we need them. People use them to get road directions, to take pictures, or to call friends. But we easily forget the power of smartphone microprocessors. Scientists with NASA, the American Space Agency, have not. In April, NASA sent 3 smartphones into space to operate as low-cost satellites. They were launched from NASA's Wallops Flight Facility in the state of Virginia. The launch was the first test flight of the privately built Antares rocket. Space agency officials gave names to the 3 phone-sats, as they are called. The names are Alexander, Graham, and Bell, after the inventor of the telephone. All 3 phone-sats looked like small cubes or boxes. Each one was about the size of a drinking cup and weighed a little more than 1 kilogram. At the heart of each was a Google HTC Nexus 1 phone. The microprocessor inside the phone serves as the brain of the mini-satellite. Jim Cockrell works for NASA in California. He says the phone-sats were an experiment to find out if a cell phone can serve as the avionics for a satellite. NASA says the phone sats operated for almost a week. They collected pictures of the Earth and sent messages to ground stations. The agency says smartphones have more than 100 times the computing power of an average satellite. Jim Cockrell notes that they also have high-resolution cameras and global positioning system receivers. So, the next time you pick up a smartphone, think about the work of the phone sats Alexander, Graham, and Bell. For VOA Learning English, I'm Mario Ritter.
From VOA Learning English, this is the Technology Report. Internet activists and human rights groups are criticizing an order that requires blogs and social media sites in Vietnam to share personal information only. The order aims to ban social media users and bloggers from posting other information such as news stories. Local media reports say the decree states that such sites are not permitted to, quote, gather or summarize information from press organizations or government websites. Prime Minister Nguyen Thanh Dong approved Decree 72 in July. Internet activists say this is an attempt by the communist government to restrict freedom of speech. Rights groups say the decree's requirements are too broad and will be used to act against government critics. Others criticized a statement by Lê Nam Thang, the Deputy Minister of Information and Communications. State media reported him as saying that the law aims to help web users find correct and clean information on the internet. But one blogger says that is a matter of personal choice. She says people should be able to decide for themselves whether information is good or bad. And she says Vietnamese citizens do not need the government to teach them how to think. The decree sets out very broad categories of speech that officials could consider as troublesome. It includes warnings about information that is against Vietnam or undermines certain principles. Sean Crispin is the Southeast Asia representative for the Committee to Protect Journalists, or CPJ. He says the increased restrictions suggest that the government thinks it has lost control of the criticism that is so widespread on social media. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Technology Report in Special English. Tokelau is a group of small islands in the South Pacific Ocean. Officials now say they have become the world's first territory totally powered by the sun. The move to solar energy is expected to save money and ease the environmental burden of depending on imported fossil fuels. New Zealand's Foreign Affairs Minister, Murray McCully, announced the Tokelau Renewable Energy Project. He said Tokelau's 3 main atolls, or islands, now have enough solar capacity to meet all of their electricity needs. He said Tokelau had been completely dependent on diesel fuel for producing electricity. That burdened the territory with heavy economic and environmental costs. Tokelau is about halfway between New Zealand and Hawaii. The self-administering territory of New Zealand has about 1,500 citizens. Each atoll received its own solar power grid system. New Zealand officials estimate the cost of the project to be about $7 million. The last of the grids was completed earlier this month. Oil imports are a big cost in some parts of the Pacific. The move to solar power could save Tokelau about $1 million a year. One project coordinator said Tokelau would now be able to spend more on social programs to help its citizens. Other South Pacific islands are attempting similar projects. The island nations of Samoa and Tuvalu are aiming to get all of their electricity from renewable sources by 2020. The Cook Islands plan to start using solar panels and wind turbines, and houses in the South Pacific groups of islands are beginning to use solar water heaters. New Zealand's Foreign Affairs Minister adds that his country will hold a Pacific Energy Summit in March next year. For VOA Learning English, I'm Laurel
the
Bowman.
VOA Special English Development Report. A new study in West Africa shows how farm irrigation systems powered by the sun can produce more food and money for villagers. The study in Benin found that solar-powered pumps are effective in supplying water, especially during the long, dry season. Sub-Saharan Africa is the part of the world with the least food security. The United Nations Food and Agriculture Organization estimates that more than 1 billion of the world's people faced hunger last year. Around 265 million of them live south of the Sahara Desert. Lack of rainfall is one of their main causes of food shortages. Jennifer Burney from Stanford University in California led the study. The research team helped build 3 solar-powered drip irrigation systems in northern Benin. Between 30 and 35 women used each system to pump water from the ground or a stream. Each woman was responsible for farming her own 120 square meters of land. They also farmed other land collectively. The solar-powered irrigation systems produced an average of nearly 2 metric tons of vegetables per month. During the first year, the women kept a monthly average of almost 9 kilograms of vegetables for home use. They sold the surplus produce at local markets. The earnings greatly increased their ability to buy food during the dry season, which can last from 6 to 9 months. People in the 2 villages with the systems were able to eat 3 to 5 more servings of vegetables per day. But making the surplus available at markets also had a wider effect. The study compared the villages with 2 others, where women farmed with traditional methods, like carrying water in buckets. The amount of vegetables eaten in those villages also increased though not as much. The researchers note that only 4% of the cropland in sub-Saharan Africa is irrigated. Using solar power to pump water has higher costs at first. But the study says it can be more economical in the long term than using fuels like gasoline, diesel, or kerosene. And solar power is environmentally friendly. The study was published in January in the Proceedings of the National Academy of Sciences. And that's the VOA Special English Development Report. You can post comments and learn about other issues in the developing world at voaspecialenglish.com.
Countries increase their efforts to hire foreign nurses. But he says this has raised concern that OECD countries were mainly exporting their shortage problem to countries that may have an even greater need for these nurses. In May, the World Health Assembly approved a global code of practice on the international recruitment of health workers. The Assembly is made up of countries in the world year called attention to the problem. For example, nearly 2,000 nurses left the Caribbean between 2002 and 2006. Caribbean nations currently have about 1 nurse for every 1,000 people. The ratio of nurses to population is about 10 times higher in the United States and countries in the European Union. Currently, more than 21,000 nurses who trained in the Caribbean are working in the United States, Canada, and Britain. Gaëtan Lafortune is with the Organization for Economic Cooperation and Development in Paris. He says the nursing shortage also affects industrialized countries. Mr. Lafortune says a large number of nurses are expected to retire within the next 10 years. At the same time, the healthcare needs of aging populations are expected to grow, intensifying the shortage of nurses. He says some researchers in the United States have projected that there may be a shortage of close to 1 million nurses by 2020. The United States is one of 31 countries in the OECD. Gaëtan Lafortune says in recent years, many of the countries. This is the VOA Special English Development Report. The healthcare industry needs more nurses. All areas of the world face a nursing shortage, but the shortage is most severe in developing countries. Many of their nurses leave. They move to more developed nations for better pay, better working conditions, and better chances for career development. A World Bank report earlier this year